I would now like to invite to the stage the Deputy Premier of Western Australia, the Honourable Liza Harvey, to present on behalf of the Western Australian Government.
Good morning, everyone. I too would like to express my thanks to Premier Anna Palaszczuk and also Maroochy and the traditional owners of the land that we're meeting on this morning, and I pay my respects to the elders past and present. Welcome to all of the dignitaries that are here and to all of the delegates. I'm very pleased to present on behalf of the Western Australian Government. I'm going to talk to a new initiative that we've put in place for the Kimberley region of the state, and then I will also touch at the end on a collaboration that WA Police, my Deputy Commissioner Stephen Brown, has had with Professor Lawrence Sherman from Cambridge University, where we've really tried to delve into and understand domestic violence incidents in Western Australia, and I've got some preliminary data that I can speak to on at the end prior to the release of that report. Now, the Kimberley region in Western Australia is one of our challenges. The Kimberley region has a population of approximately 40,000 people. Those people are dispersed across 423,000 square kilometres. That's about 71 times the size of Brisbane. Those people are located in 6 towns, Broome, Derby, Fitzroy Crossing, Halls Creek, Wyndham and Kununurra, and 185 Aboriginal communities. The populations of those towns are mainly Indigenous. There's an average of 44% of the region's population are Aboriginal. That ranges from 37 to 79% in the towns, but the remote communities are almost 100% comprised of Aboriginal people. When we have a look at family violence in the Kimberley region, the statistics there are horrific. The rate of hospitalisation for domestic assault in the Kimberley was 35 times higher than the rate of hospitalisation for the metropolitan Perth, and 4.2 times higher than the next nearest district, which is the Pilbara. Now, that's only hospitalisations. That does not take into consideration outpatient presentations or outpatient treatment services. In the Kimberley, there's been a significant increase in the number of family violence incidents that have been reported to police, 79% increase in fact, which is double the increase in reporting for the rest of the state. When we have a look at who these people are and what's happening there, Aboriginal women are grossly overrepresented as victims of domestic assault, but also non-domestic assault. Looking at the activity, the use of police orders has increased by 335% in the Kimberley, but the application rate for violence restraining orders has reduced by by 23.4%. When we have a look at the activity that comes out of those reports of domestic violence, domestic assault reports, perpetrators being charged for domestic assault, we've seen a reduction of 22%. Sexual assault, we've seen a reduction of 42%. But this is at odds with offenders charged with breaches of restraining orders, which is up 125%. So we went down to grassroots and started working with community. In an area the size of the Kimberley, government, we need to have a community-driven approach, and the community-driven approach needs to be culturally appropriate. Our plan, which was built on an intensive report conducted at grassroots level with all of the key responders, the victims of violence, perpetrators of violence, and the government agencies who work on the ground in the Kimberley, our plan was built from the grassroots up. It's largely a service plan, and the service plan is looking at ensuring that we have a shared responsibility for the safety and wellbeing of children, individuals and families in the Kimberley community. We know that a poorly integrated service response results in significantly increased risk factors for victims falling foul of the system and not being able to be provided with support, but also for perpetrators being able to become lost or invisible to the system. So our plan was built around developing culture and community-based responses, building stronger and safer communities, and developing an integrated, culturally secure, client-oriented, accessible system. We've developed that into a work plan for the next year. That work plan involves engaging with our communities, developing new services. Those new services are a Kimberley Family Violence Service, family safety teams, and also combined substance use and family violence programs. We're increasingly looking at improving training to our first responders, bearing in mind that our first responders in places like the Kimberley may not be family violence trained, they may not even be law enforcement officers, they may be teachers or other health workers in the region. We've worked on improving our procedures there and establishing some database lines. We need to get a format in place where we can actually monitor and evaluate our performance in this with respect to this frameworks and the new governance arrangements we've put in place. So our intention is to adopt a culturally secure approach to family violence prevention and intervention. The first tasks were engagement, obviously, with the key stakeholders, our Aboriginal law people, our elders, our community leaders and our community groups were the key stakeholders that we need to build our response around. We've engaged Dr. Victoria Hovain of Jalara Consultancy to start to undertake this work. Vicky is a Kimberley woman and a trained psychologist, and she's been committed to improving the safety and wellbeing of Aboriginal people in the Kimberley over the long term. The consultation and engagement with our communities has included defining safety responses, safety plans, looking at successful families and communities, and also assessing the readiness, the benefits, the resourcing that's been required, the risk and risk management strategies for individual communities. We will use that information to inform our future goals and actions, and also promote activities that will assist in healing our Aboriginal communities and Aboriginal people. We need this plan to acknowledge that healing from trauma is a process, it's not an outcome, and the healing can take many forms, and through that healing we can start to develop our respectful relationships, promote better awareness of family violence, and also promote appropriate family relationships that are respectful, safe and secure for all members of those families. One of our initiatives is our family safety teams. The family safety teams have required some additional resourcing. Family safety teams involve a co-location of staff and a joint assessment triage process of the family violence incident reports. So police lead that team with a triaging process, but the teams engage corrective services, our Department of Child Protection and Family Services, specialist family and domestic violence non-government services. But in addition to that, we're funding through that Kimberley Family Violence Service the additional resources, which are importantly men's family violence workers in Broome, Derby, Kununurra and Halls Creek, and additional women's family violence workers in Broome and Fitzroy Crossing. We've got safe houses now in the 6 towns, including the remote community of Columbaroo. With the assistance of the Commonwealth, we have a safe house now in Jarragin, which is one of our remote communities on the peninsula. When we look at the purpose of our family safety teams, the purpose is to promote the safety and recovery of adult and child victims of family violence. They have a responsibility to engage and respond to perpetrators. They need to provide the collaboration and coordination and support of the agencies. They are required to raise awareness about family violence and domestic violence by engaging with the community and with families. They also have a very important role in promoting respectful relationships and in community safety planning, looking at risk management and ensuring that we have risk mitigation strategies in place. The next stage of the plan is strengthening our response. WA Health have introduced standardised forms for family and domestic violence screening, assessment and referral. So what that means is there's now a standardised format where, upon the presentation of victims of family violence, there is a referral to crisis accommodation and family safety teams, for example. We're strengthening our police responses in the Kimberley district. We're looking at, obviously, expansion of outreach services. One of the interesting things we found was that we need better education processes around violence restraining orders. What we've found was victims were inclined to request that violence restraining orders were stopped. They didn't understand that there might be an opportunity to vary the conditions of a violence restraining order. And there also wasn't a lot of confidence in that those violence restraining orders actually improve the safety of victims. And that is sometimes indicative of the very small communities within which people reside. It's difficult to have a violence restraining order applicable in a community where it's nearly impossible to keep a safe distance between an offender and a victim. So there's some work to do there. We're looking, the next stage is also training in common risk assessment and risk management, and we've established a framework to ensure that this occurs, and it's one of those areas that we can manage and evaluate as we move through our planning and the implementation of our plan. The other part of it is also, as you've seen in previous presentations from other premiers, looking at that multi-agency case management approach to high-risk family and domestic violence cases. So the next steps, building capacity in our Aboriginal communities to ensure they can respond to family and domestic violence incidences. The implementation of a strong law and culture approach so that we can ensure alignment with existing services. We need to ensure that we're responding to family violence in ways that increase safety for women and children, hold perpetrators accountable for their violent and abusive behaviour, and work with perpetrators to try to change the outcomes. We're not going to change the outcomes in these communities if we don't do that very important work with the perpetrators of family violence, challenge their behaviour and provide opportunities for them to change that behaviour. We need to identify the points of alignment between a new culture-based approach to family violence and ensure that we can integrate that with our existing service systems. The other next step is to establish a community engagement framework that becomes part of the way we do business in the Kimberley. So that needs to be culturally secure, it needs to be client-centred, it needs to be accessible, and it needs to be effective and applicable throughout not only the Kimberley region, but obviously we can carry that forward throughout the rest of the state. So Kimberley as a touch point gives you a snapshot of some of the challenges we face in Western Australia with family violence. But I'll just touch briefly and give you some preliminary results of some very interesting work that we've done in collaboration with Professor Lawrence Sherman of Cambridge University. Now, this report will be released at the end of November. And what we did was try to understand and drill down into exactly who our domestic violence offenders were. The results were quite startling. WA Police, as part of this collaboration, examined nearly 215,000 reported incidents of family violence between 2010 and 2015. That's around 55,000 reports per year of family violence in Western Australia. Those convert to around 26,000 domestic violence incident reports. So of those nearly 215,000 reported incidents, about 100,000 had criminal convictions linked to them. Non-crime, though, came out at about 114,000. We have 53,900 known victims of 36,000 known offenders. 67% of our domestic violence homicides during that period had had no prior call to police. Of the offenders in that cohort, 44% of the offenders were known to us for other reasons, and that was in 76% of our cases. Now, what we found was that 2% of our offenders were responsible for 50% of the serious harm incidences. 2% is 676 men and 28 women. This gives us an opportunity. 80% of those offenders, over half, 54% of them had non-Aboriginal victims. About 128 of those offenders had Aboriginal victims. But almost half, 43% of our offenders, 307 of them, had had more than one victim over the previous 5 years, and 119 of those offenders had 3 or more different victims in the previous 5 years. Of the offenders, over 20% of them reported were known to police and had convictions for either child sex offences, they had a known mental health issue, they had a known history of attempted self-harm or self-harm incidences, and were drug users. So 20% of them had one or more of those factors. So what this gives us, and when the report is finalised at the end of November, it gives us a really good opportunity and a plan for action to the future. We know if we target those 707 offenders, that we have a significant opportunity to reduce the serious harm in our community. The other startling fact, which is one of those areas that's going to be difficult for us to address, 80% of our most harmful incidences, the offenders had no record of any domestic violence in the preceding 5 years. So these are the serious hospitalisations and the homicides. 80% of them we'd had no record of. So this goes back to reporting of family violence. 143 of those offenders did have previous records, but the records had indicated no trend in escalation of violence. So we've got some interesting work ahead of us as a result of this study. But what we are pleased with is that we have an opportunity now to delve into the histories and to focus on those 707 offenders who have repeat history with us. And hopefully out of that, with the great work that WA Police do with those offenders, we might start to see a reduction in the serious harm incidences in the family violence space in Western Australia. So thank you all for being here and for your commitment to reducing family violence in the community. I've certainly learnt a lot from the presentations prior to mine and from the discussions with my colleagues last night. And I thank you all for your commitment, for being here, and particularly to my Western Australian colleagues. It's often a little bit harder for us to get here and a little bit longer and takes a fair bit of effort, and I really do appreciate those people, particularly from the not-for-profit sector, who work with family violence on a daily basis, for taking the time out of their schedule to come to this conference. Thank you.
Thank you very much indeed, Deputy Premier Liza Harvey, and fascinating learnings from that. And indeed, thank you to all of those who have come from such a far distance.